The government of India has approved vaccination in pregnant ladies in India for the available vaccines in India, that is Covishield, Covaxin and Sputnik. Government further advises that this vaccine can be taken in any time of during pregnancy. That's one thing, and it does not recommend one vaccine or another. That's another thing. And government has not shared any data of these three vaccines in pregnant ladies in India, any research or safety data available for in pregnancy. And in its advisory, what is published in its website, it recommends based on the USA CDC, Center of Disease Control, CDC USA recommendation, it take as a reference point. But the question is, CDC USA actually bases its recommendation based on the data available, based on the vaccine of the brands, mainly Pfizer, Moderna and Johnson and Johnson. So CDC does not bases its recommendation of safety in pregnancy based on the any data available to Indian vaccines. Vaccines available in India like Sputnik, Covishield or Covaxin. That the point is to be noted. In general, the vaccines in pregnancy in the past have always been safe. Vaccines now recommended in pregnancy for COVID is based on what's the standard modern medical principle, that is benefit which outweighs the risk. So if the benefit is much more while giving the vaccination to the pregnancy compared to the risk of vaccination and its subsequent side effect, if any, then based on and which actually in this case favors pregnant ladies getting vaccinated by COVID-19, the benefit is much more than the risk. As a general principle, the live vaccines are not so recommended in pregnancy. So in this case, the inactivated killed vaccine, that is in India we have Covaxin, that technology based vaccine could be much more safer in pregnant ladies. Time during pregnancy is safer to take this vaccine. So although government has recommended any day of the or any period of the pregnancy, usually the first 3 months of pregnancy in any female is very delicate period. So I would prefer, if possible, the vaccine the pregnant lady could take after first trimester, meaning after first 3 months of the pregnancy period, then you can take the vaccine. It could be a bit safer. So certain symptoms of side effects of COVID-19 vaccine in first 20 days you can watch out for, like problem with breathing, like difficulty in breathing, chest pain, and pain in the limbs, pain pressing the limbs and swelling in the limbs, and small pinpoint hemorrhages or bruising in the skin in the vaccination site, or any persistent abdominal pain with or without vomiting, seizures in the absence of previous history of seizures, and persistent headache is there with or without vomiting, and weakness or paralysis of limb if it occurs any particular side of the body, and persistent vomiting without any obvious reason, and blurring of vision, pain in the eyes. So these are the symptoms the pregnant ladies has to watch out in at least for first 20 days after receiving the COVID vaccination. My advice would be taking COVID vaccination if you have a choice, preferably inactivated killed vaccine like Covaxin, and the period would be, I would recommend, would be after first trimester, after first 3 months of pregnancy, you can take the vaccination.